Welcome to Exercise for Beginners, where I teach you how to get started if you've never started before. This week, I'm going to touch a little bit on hip mobility. So some of you might be wondering, hip mobility, isn't that the same as flexibility? And the answer is kind of, sort of, yes, no. There's a lot of overlapping factors when it comes to how the body works, and mobility is one of those factors. So when we are comparing mobility versus flexibility, a lot of people kind of think they're interchangeable. There is some subtle differences. So with flexibility, that is typically in regards to your muscles themselves, those muscle bellies, right? So that is how flexible the muscles are. Mobility has more to do with how well do your joints move within their sockets, right? So mobility has a lot more to do with the functional anatomy of a joint, while flexibility has more to do with how well does a muscle elongate and contract, right? So with mobility is like a combo of, maybe you have some things that are tight and some things are weak, which is causing, that hip to not fully open or close or raise and extend, what have you, right? So there's multiple factors working against that joint that may allow it to move well or to be more inhibited, right? So mobility is not just flexibility. There's a couple factors at play. It's usually a combination of a couple things that, like I said, may inhibit the movement of that joint, right? So check your ability to do this all the way around. Lost my mic. It's the ability, to move your shoulder into circumduction, to move your hip in full circles in and out, right? That's mobility, right? So if you're struggling with that and getting those full big circles, you might not have that full range of motion, right? That's where you see that ROM in a lot of articles and other videos out there. So that's what we're going to work on today. We're going to do some hip mobility exercises. So this is just moving the ball in the socket in different directions and seeing if you have that range of motion. I don't do these things all the time. I definitely sprinkle one in here and there for good practice in my own clients' programming, depending on what else I have them doing. So I think they're good to throw in here and there. Just good to know, good to check in with yourself. Is this working well? Is it not? Do I need to strengthen something? Do I need to stretch something else? And then circle back to it. So, all right, we're gonna get started. Okay, the first exercise we are gonna do is a hip cars. So you probably see people like at the gym or in like physical therapy, they're doing like those big arm circles, against the wall, palm to the wall. That's a shoulder car, right? So this is kind of a similar motion. So for this, you're going to be on all fours. You're going to kick back, foot up to the ceiling, like so, like you're doing a donkey kick. You're going to come out to the side and around. Back, out to the side, around. So with these guys, you're going to do 5 to 10 in one direction. And then you're going to switch, come out to the side, and come back in the other direction. So clockwise and counterclockwise, basically. All right, the objective is to make your hip circles as big as possible. Keep your knee bent though. This isn't a straight leg exercise. This is a bent knee exercise. All right. Okay, from here, we're gonna do something similar, but it's gonna be with a straight leg. So it's like a hip, extension with a rotation and an abduction, right? So again, you're gonna be on all fours. You got your straight leg here. Want to make sure those hip bones are facing the floor. You're going to kick up, rotate out, kick to the side, and back. Once your leg's up, you don't have to go back to the floor anymore. So just getting the joint moving in different directions. Yeah, do 2 more here for you. Good. All right. The next one we're going to do is a hip extension. So for hip extensions, you're going to lay flat on the ground. All right. And you want that, go away. You want that hip bone to be in the ground when you rotate your leg up, right? So when you extend up, your hip bone up front here should be hitting the floor, right? So you're not bending your knee, right? That's not the objective here. You are rotating in the socket so that your hip bone hits the floor, squeezing your glute and using your hamstring. All right, so rotate and kick up. Just like you're kind of kicking behind you, right? Like I said, you should feel that hip bone roll into the floor, and you should feel a little bit of glute and hip activation with this one. For the last two, you're going to need a yoga block or something about that size that's firm. Okay, so we're going to be doing some hip flexion rainbows. So for this one, adjust your height. You can do the low height, medium height, or high. I typically go medium for myself. I will preface, anytime you're doing a hip flexion from a seated position, you may cramp. I did totally just try to film this video, and I did cramp, and it was terrible. Just try and walk it off. I don't know what else to tell you. It sucks. But it is a good exercise for your range of motion. So you're going to sit up nice and tall. I like to drive my fists into the ground, like next to my hips. Sit nice and tall. You're going to kick up and over, up and over. So ideally with this one, over time, you could sit up more and more. Or you could sit against a wall. That's really going to prevent you from cheating too much. But I do find that the fists into the floor is a happy medium for that. So just do your best. If you cramp, just try and breathe through it for a minute. Okay, and last but not least, you are going to lie on your side, just like arrow here. All right, you're going to lie on your side. Your bottom leg is going to be straight. Top knee is going to go on your block. All right, you want 90 degrees at the hip, 90 degrees at the knee. And you're going to press your knee into the block and rotate up, kicking your heel up first. Try and relax your toes. All right, so rotate up. So this you'll feel, in that glute med and your side butt here. So rotate, squeeze and rotate, press and rotate. Internal rotation is one of the ones that most people struggle with. So if you don't have a lot of range, that's okay. You can also hold it, right, to kind of just activate, get the brain refamiliarized with how to move that joint. Yes, that is a thing. It is weird. All right. I definitely start to feel this one even without a band sometimes. Later on, I'll do it as a banded exercise. All right. Those are your 5 exercises for today. If you enjoy this content, please tell your friends, tell your family, tell your coworkers, tell whomever. I am not trying to be an influencer, but I do have a lot of stuff to share. And if you find this this information useful, I'm happy to have you use it. I try to post every week, ideally Tuesdays, but that doesn't always happen. But it will be every week. And if you have any questions, please reach out. Subscribe to my channel if you like my content. Thanks.